You do not become a doctor in a hospital. You begin with an acceptance letter, excitement, and no real idea what it will cost. The first anatomy session changes the tone. Medicine is no longer just a dream. It is responsibility in its rawest form. The textbooks get thicker. The exams get harder. Every system of the body feels like a language you must learn overnight. Then you meet your first patient. Suddenly, knowledge has a face, a voice, and fear behind the eyes. You forget a question, stumble through an examination, and realize kindness cannot replace competence. While friends sleep, you revise symptoms, drugs, red flags, and diseases you hope you never miss. Final exams arrive like a wall. Years of work are reduced to stations, questions, and controlled breathing. When you graduate, everyone calls you doctor. You smile, knowing the real test starts on the ward. The bleep goes off before you know where the toilets are. Someone needs fluids. Someone needs pain relief. Someone is deteriorating. The consultant moves quickly. You write notes, chase scans, update families, and try not to fall behind. A patient crashes. The room fills. Your heart pounds, but your training gives you the next step. Afterwards, your hands shake in the corridor. No one teaches you how heavy survival can feel. You sit with a family and explain what no one wants to hear. The words must be clear, but never cold. Then another patient improves. They walk out smiling, and for a moment, every difficult shift makes sense. Weeks blur together. Meals are missed. Sleep disappears. You learn that caring for others can hide the fact you're running empty. A senior doctor notices and tells you something important. Good doctors ask for help before they break. You rotate through medicine, surgery, emergency, pediatrics, and intensive care, searching for the place that feels like purpose. Once you choose, the pressure sharpens. You're expected to know more, decide faster, and lead earlier. The first procedure you perform without someone taking over feels terrifying, then unforgettable. A thank you card appears at the nurse's station. It is simple, but you keep it longer than any certificate. Targets, waiting lists, bed shortages, and staffing gaps remind you that medicine is also a system under strain. Sometimes you know what a patient needs, but the system cannot give it quickly enough. That pain follows you home. As a registrar, junior doctors look to you for answers. You remember being the person silently hoping someone else knew what to do. At 3 a.m., the hospital feels like another planet. You prioritize, reassure, escalate, and keep moving. Years later, you sit across from a panel, trying to explain not just what you know, but who you have become. As a consultant, the decisions are yours. The juniors watch your clinical judgment and your humanity. You slow down to teach, because the next generation of doctors will carry patients you will never meet. Being a doctor was never just saving lives, it was standing beside people at their most vulnerable and choosing to show up again tomorrow. Before the impressive moments, there's always a hidden routine. You check the basics, prepare properly, study the details, and remove as many avoidable mistakes as possible before pressure has a chance to expose them. For a doctor, this plays out across lecture halls, wards, clinics, emergency bays, operating rooms, and quiet hospital corridors. The pressure is specific: diagnosis, tiredness, families, waiting lists, clinical risk, and the fear of missing something important. That is what makes this path feel different from anyone else's story. There are moments when you wonder whether you are actually good enough. You look at people further ahead and assume they are fearless, then slowly realize they are just better at moving while afraid. For a doctor, this plays out across lecture halls, wards, clinics, emergency bays, operating rooms, and quiet hospital corridors. The pressure is specific: diagnosis, tiredness, families, waiting lists, clinical risk, and the fear of missing something important. That is what makes this path feel different from anyone else's story. The first real test never arrives in the perfect shape. It is messy, badly timed, and full of missing information, which is why the lesson stays with you longer than any easy win. For a doctor, This plays out across lecture halls, wards, clinics, emergency bays, operating rooms, and quiet hospital corridors. The pressure is specific: diagnosis, tiredness, families, waiting lists, clinical risk, and the fear of missing something important. That is what makes this path feel different from anyone else's story.